Jeevan,
Hello.
please can you explain what exactly you and your team are doing in Ayurveda?
We are a team of Ayurveda doctors, health and also German school medical doctors. Actually, I am working in Germany, in different parts of Germany, also in Berlin, Nuremberg and all. What we are trying to do is to bring a little bit of traditional Ayurveda medicine into Europe. So this is a different type of Ayurvedic treatment, consultations, then educational based things, teaching Ayurveda to different public levels and also for doctors level and all.
Interesting. And what exact benefit can a patient get from Ayurvedic way of living and the treatment also?
Yeah. So this is a very big question, Ayurvedic way of living, because it's not only giving some Panchakarma treatment or not only giving some massages or Ayurvedic cooking or something like this. A person is getting connected to the Mother Nature. So actually you are living in the rules of the laws of Mother Nature. Now you are harmony with the nature. So it's a way of living. It's a patient gets normally diet or a nutritional guidelines, depends on the constitution, we say prakriti. And second one is they get exactly what they have to do in their daily life, because you know that most of the diseases are based on different stressful conditions. It's not only a virus or bacteria or something like this. Nowadays it is a multi-causal problem. So you need a multidisciplinary system. So it's not only giving an Ayurvedic Panchakarma treatment, oil massages or something like that. So the patient should get from different approaches. So you need a nutritionalist, Ayurvedic way of nutrition. You need a what you call a psychologist, an Ayurvedic way of psychotherapy. No? So we have to touch the mental, physical and the spiritual level of a patient. That's what mainly Ayurveda explains. And this is nowadays it's losing also in India. No? So we need an approach to touch all aspects of a patient.
Can you please explain what the Panchakarma treatment looks like and for which diseases it is beneficial?
Okay, so a Panchakarma program has a certain follow-up or a certain rule. Now we have 3 stages in Ayurveda, how a Panchakarma program looks like. For example, the first stage is called Ama Pachana. That means to mobilize the toxins. Ama means toxins. So we usually give several kind of herbal preparations internally to a patient, depends on the disease. This is done in the first stage by a consultation with the Ayurveda doctor, and he gives the medical preparations, depends on different diseases, and also a nutritional guidelines, what is good for his disease to subside or what is good for his constitution. So nutritional guidelines and the Amapachana preparations are the first stage, and during this time also we fix for a Panchakarma treatment. It's gestation treatment for 14 days, 21 days, 45 days, like this longer duration, that also we fix in the first stage itself. So after taking this internal preparations and the nutritional guidelines, we start the Panchakarma treatment in inpatient. So usually in India we do 45 days, 28 days and all. Also in Germany we are also doing this one, but this is a little bit costly affair in Germany, but still we are doing this one for a longer treatment. During the Panchakarma time, the second stage, the patient get a different type of oil applications. This also I want to explain very clearly. It's not oil massages, because the medicinal oils has a property. So it is not the massage is important, it's the oil application, different type of oil application. Sometimes pouring oil on the body, sometimes pouring oil on the head, sometimes what do you call herbal balls, herbal paste, no, applying on the body, depends on the diseases. And then what happens during this time is the toxins are mobilized again and it will come into the internal pathway. That means the mouth up to anus, we have a canal, and the toxins come into this stage with this all external applications. And then we take out these toxins through different orifices, that means through anus, like purgation, or like therapeutical application of medicines through rectum, no, we say vasti, or sometimes what you call vomiting treatment, therapeutical vomiting, sometimes through the nose, and sometimes also through the blood, like recta mocha, or what we call as what you call bloodletting. Bloodletting. So these are the 5 different cleaning methods which the toxins comes from this external oil herbal applications which come into and take it out. So this is the second stage. So the patient is clean in the second stage. Yeah. The third stage is after the cleaning, we have to rebuild the immune system, and that's a follow-up. This is the patient is going on with the internal preparations, external oil applications, a good nourishing nutritional guidelines for the till the next year. Till the next year Panchakarma is doing, they are following this one, and this is called, we call it Rasayana. So we have 3 stages which I mentioned to you. One is Amapachana, second one is Purva Karma and Panchakarma, that means the external applications and the cleaning methods, and the third one is the follow-up or the immune enhancing preparations and to lead a lifestyle, because you are already cleaned, and then you have to lead a good lifestyle after the cleaning. Because in olden time, the old sages, rishis are explaining, if you want to take a cloth and to dye a cloth, to color a cloth, first you have to clean.
Yes.
Yeah. So the same concept is there, that you have to clean the body and then to improve the what you call, improve the body immune system and all with the follow-up treatment. But to tell you the sad things in Europe, what I have seen in the last 15 years, people are only interested for the Ayurvedic oil massages, and that is not Ayurveda.
Massage is what people know.
People know. Yeah. And then the other one is even the massages are done, what happens, I told you that the toxins will come back into the internal core, and nobody talks about purgation or enema or nothing like that. No, so the toxins are still stagnated in the body. No?
So is it advisable to do a Panchakarma treatment once a year?
Yes, sure. One thing is the patients, they have to repeat in every year, depends on the chronicity of the disease. And the second one is those who wants to what you call, to preserve their health, then also they have to do once in a year. When you think about when we buy a car, for example, we have to do always this oil changing and cleaning inspection and things like this, and still it is working for 15 to 30 years. But how can you think about the 100 years old machine without proper cleaning or proper panchakarma? How we can expect that this machine will go on working?
So which diseases can you treat with Ayurveda?
This practically, I can say some of the diseases which are giving very good results. When in Europe, when I think about polyarthritis, rheumatoid arthritis, like the bone and joint diseases, like gout, no, or sciatic neuritis, no, lumbago, no, several bone and joint diseases. Then the neurological problems like multiple sclerosis, which is not so much success in modern medicine, this is also very important to help with Ayurveda. I am not telling that you can heal completely or something like this, but to help for the movements and the what you call the numbness of the fingers, and also for the what you call the balance and all. No, this you can really help with Ayurveda.
That means you can delay a little bit.
Delay this process and all, and also you can stop the process also in some of the diseases. Another one is what interesting is psoriasis, skin diseases, no, which is usually we do mask of cortisons, no, but instead of that. We can do so many things with Ayurvedic treatments, internal cleaning and all, because skin is a byproduct of a blood. So if you clean the blood, or if you prepare to make a good blood with your nutrition, no, the skin is much better. So that's also something very special. But when you think about the whole diseases, if you give a good nutritious guideline and a proper way of life, I think that in Ayurveda you can help in almost all the diseases. No? But practically when I say that, it is more for polyarthritis, multiple sclerosis, migraine, psoriasis, no? Then menstrual disorders, no? Infertility. No? These are all some of the cases which I have also done in
burnout
Europe.
also,
burnout syndrome. No? These are all something which we can with the Ayurvedic way of living.
Nice. So what is your message to the public?
Yeah, the message to the public or to the people who are seeking for an alternative system of medicine, I say that there is not only one way of thinking, that is not only help from school medicine or something. There are several other medical systems like Ayurveda, Chinese medicine, several type of what you call exercises, no? Pranayama and all from yoga. So there are several methods which a person get help from different. So instead of criticizing that Ayurveda is only an exotic medicine or Ayurveda is only a wellness therapy or treatment, so people should try, the patient should try the benefits what we are getting from Ayurvedic treatment, and then only to tell an answer that it is medicine or it is not. No? So I tell that people should try in Europe who are all having some of the body and mind diseases, for example like rheumatoid arthritis and MS and things like this, and all to try for Ayurveda, and it's not in 1 second you don't get this treatment benefit also, no? Because it's a long treatment. That first they should understand, they should spend time for that, and they should also see that I need a change, because without change you cannot get it helped. So they should themselves have an understanding that I need a change in my life because I have a alarm signal as a disease. No? So you need a change. So change can be from just by swallowing a pill. No, it's not a treatment. So you need a total change in your system. So Ayurveda, to conclude, is it's a lifestyle. It's not one panchakarma or one massage. Yeah. So the people should try this traditional, authentic Ayurveda. And to tell you the truth, that itself is getting reduced even in India. No, the people who come from Europe or something, they are missing this first stage of Amapachana. There is no consultation, there is no nutritional guidelines. They directly come for the second stage for the oil treatments. No, so the toxins are not mobilized. So that's one of the things that a traditional, authentic Ayurveda to follow, then only you get a results. No? So that is important that even in India and even in Europe, who are all practicing, to come back to the roots, no? To what the Ayurveda explained in the old treatises and how it should be. Then only you get a results, or else it's just money and waste of time.
I think the fact that more people in Europe are seeking for alternative medicine like Ayurveda also shows that what you are doing is right and is showing some effect.
I hope so.
Yes. Thank you very much for that interview.
Thanks a lot also.